We've all experienced foot pain at some point in our lives, whether it's from a long day of walking or a tough workout. But do you know when it's time to pay closer attention to the pain in your feet? I'm Houston podiatrist Dr. Andrew Schneider. I'm board certified with over 20 years of experience. Certain types of foot pain are not to be swept under the rug, as they could signify underlying health conditions that require immediate attention. In this video, we're going to talk about 5 common foot problems that you shouldn't ignore, their causes, and how to prevent and treat them. Also, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. Foot pain can be a result of various factors, ranging from daily activities to medical conditions. Before we delve into the types of foot pain you shouldn't ignore, it's essential to understand the causes of foot pain. This could be due to standing for long periods, wearing ill-fitting shoes, overuse during exercise, or even an underlying health issue such as arthritis, diabetes, nerve issues, or injuries. The first type of foot pain you shouldn't ignore is heel pain. There are 2 main causes of heel pain: plantar fasciitis and Achilles tendonitis. Plantar fasciitis is when the thick band of tissue that connects your heel bone to your toes, called the plantar fascia, becomes inflamed. This can cause a sharp stabbing pain in your heel, especially when you take those first steps first thing in the morning. Achilles tendonitis occurs when the Achilles tendon, which connects your calf muscles to your heel bone, becomes irritated or inflamed. This can cause pain and stiffness in the back of your heel, making it difficult to walk or even stand. Some common causes of heel pain include high-impact workouts, standing for long periods, and walking on hard surfaces like concrete or asphalt. To prevent and treat heel pain, make sure that you're stretching your feet and calves regularly and wearing the appropriate shoes for your activities. With both causes of heel pain, the first step is usually conservative treatment measures. What does that mean? Well, you might need to limit your physical activity, especially ones that place excessive stress on your heel. Ice packs applied to the affected areas can reduce inflammation and pain. Anti-inflammatory medication can help too. Physical therapy exercises can be beneficial. In stubborn cases, extracorporeal shockwave therapy, platelet-rich plasma injections, or surgery might be needed. Next up on our list of foot pain you shouldn't ignore are stress fractures. A stress fracture is a tiny crack in the bone, often caused by repetitive force or overuse. In the foot, stress fractures are most common in the metatarsal bones, which are the long bones that run from your midfoot to your toes. Stress fractures can be caused by activities like running, jumping, or even just standing for long periods. They can be more likely to occur if you've recently changed your workout routine, started exercising on a new surface, or have been wearing improper footwear. One thing to note is that stress fractures may not show up on an x-ray immediately. So if you're experiencing persistent foot pain, it's important to see your podiatrist. To prevent stress fractures, make sure you're gradually increasing the intensity of your workouts and wearing supportive shoes. To treat a stress fracture, first and foremost, you've got to give your foot a break, literally. Rest is crucial to allow the fracture to heal. You may need to stop doing the activities that caused the fracture or modify it so you're placing less stress on your foot. Depending on the location and severity of your stress fracture, I might recommend a fracture boot to immobilize the foot. Physical therapy can also be beneficial once the fracture starts to heal. It can help to improve flexibility, strength, and balance. And in rare cases, when the fracture doesn't heal properly, surgery may be required. The third type of foot pain you shouldn't ignore is peripheral neuropathy. This condition occurs when nerves in your feet become damaged, often due to diabetes, but can also be caused by other factors like injury, infection, or vitamin deficiencies. Symptoms of peripheral neuropathy can include numbness, tingling, or a burning sensation in your feet. In more severe cases, you might lose sensation in your feet altogether, which can make it difficult to walk or even stand. Preventing peripheral neuropathy involves managing the underlying cause, like controlling your blood sugar if you have diabetes. If you're experiencing symptoms of peripheral neuropathy, it's important to see a doctor for proper diagnosis and treatment. Peripheral neuropathy can be tricky to deal with. Since it's often related to an underlying condition, such as diabetes, the primary focus is managing that condition to prevent further nerve damage. In terms of relieving a painful neuropathy, pain relievers and other medications can be used to manage nerve pain. I might recommend a topical compounded cream or lidocaine patches to help with pain relief. Physical therapy can improve your movement and strength, which can in turn help to manage peripheral neuropathy symptoms. If your neuropathy is linked to a vitamin deficiency, I might suggest vitamin therapy. In severe cases of peripheral neuropathy where the pain is intense, treatments such as spinal cord stimulators can be used. The fourth type of foot pain you shouldn't ignore is Morton's neuroma. This condition occurs when the tissues around one of the nerves in your foot thickens, causing a sharp, burning pain in the ball of your foot, often between your third and fourth toes. Morton's neuroma can be caused by wearing high heels or tight shoes that squeeze your toes together, as well as activities like running or jumping that put a lot of pressure on the balls of your feet. To prevent and treat Morton's neuroma, make sure you're wearing shoes with plenty of room for your toes and avoiding high heels when possible. If the pain persists, your doctor may recommend padding or inserts for your shoes, anti-inflammatory medication, corticosteroid injections, or even surgery in more severe cases. Last but not least on our list of foot pain you shouldn't ignore are bunions. A bunion is a bony bump that forms in the base of your big toe, causing it to lead towards your other toes. This can cause pain, inflammation, and even difficulty walking. Bunions are often caused by wearing tight, narrow shoes that force your toes in an unnatural position. They also can be hereditary or the result of other foot problems like flat feet or arthritis. To prevent or treat bunions, make sure that you're wearing shoes with a wide toe box that allows your toes to spread out naturally. If you already have a bunion, you might find relief from wearing special pads or inserts in your shoes. Or in more severe cases, your doctor may recommend surgery to correct the problem. So there you have it, 5 types of foot pain you shouldn't ignore. Remember, it's important to pay attention to your feet and take care of them as they're the foundation of your entire body. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. If you're experiencing any of these issues, don't hesitate to contact our office for proper diagnosis and treatment. The link to request an appointment is in the description. Thanks so much for watching, and have a great day.